Welcome to McLaren Physician Partners Rechecking a Patient's Blood Pressure Education module. This is process validation for quality improvement. At the end of this educational session, participants will have completed the following learning objectives from each category. Knowledge. Review the fundamentals of blood pressure measurement and the factors that influence blood pressure. Analysis and application. Demonstrate when it is appropriate to recheck a patient's blood pressure using the defined threshold and accurately documenting both blood pressure readings in the patient's medical record. Attitudes. Attest to the importance of communicating to the patient why rechecking a blood pressure is important. Knowledge. Let's start with going over the blood pressure basics. By measuring a patient's blood pressure, or BP, you obtain information about the effectiveness of the heart's contractions and the adequacy of blood volume and the blood flow in the body. Blood pressure is dynamic. It can vary from minute to minute as the heart adjusts to demands and responses of the body and mind. The average blood pressure in a healthy adult is less than 120/80. Here are some adult blood pressure categories. Again, a normal blood pressure in a healthy adult is less than 120/80. An elevated blood pressure has a systolic reading of 120/129 and a diastolic less than 80. High blood pressure, which is hypertension stage 1, has a systolic reading of 130/139 and a diastolic of 80/89. High blood pressure hypertension stage 2 has a systolic greater than 140 and a diastolic of 90 or higher. Hypertensive crisis, where emergency care is needed, is a systolic reading of higher than 180 and a diastolic higher than 120. Here are some good terms to know. Hypotension occurs when a patient's blood pressure is too low. The heart does not pump enough oxygen to the brain. Hypotension can be benign or a symptom of an underlying medical condition such as arrhythmia. Hypertension occurs when a patient's blood pressure is consistently too high. The provider will diagnose hypertension through repeated accurate blood pressure measurement, home screening, and ruling out white coat hypertension, also called masked hypertension, or secondary causes of hypertension. Another term to know, which we briefly just went over, is white coat hypertension. Again, also called masked hypertension. This occurs when a patient's blood pressure rises temporarily due to stress or anxiety when entering a medical environment. The magic numbers. Always remember the reading of 140/90. For adult patients 18 years and older, if either the systolic or diastolic blood pressure is at or above 140/90, plan to retake the reading before the end of the appointment. The second reading should be separated from the first by at least 2 minutes. A blood pressure should also be retaken at your provider's discretion. Here are some HEDIS guidelines to remember. The National Committee for Healthcare Assurance, NCQA, considers 140/90 the threshold for hypertensive patients under its HEDIS guidelines. NCQA is a nonprofit organization dedicated to improving healthcare quality. Each year, NCQA publishes an updated set of HEDIS guidelines. Healthcare Effectiveness Data and Information Set, HEDIS, is a tool used by the majority of America's health plans to measure performance on important dimensions of care and service guidelines. Let's now go over missing documentation. MPP's quality department reviews patient medical records throughout the year. Failure to retake a patient's blood pressure at the 140/90 or above threshold is one of the most common pieces of missing documentation. Failure to retake a blood pressure may result in overdiagnosis of hypertension, lack of an accurate clinical picture for those with true hypertension, and underdiagnosis of white coat or masked hypertension. Let's now go over the importance of documenting correctly in a medical record. Both the original blood pressure and the retaken blood pressure must be documented in a medical record, as well as the date and location the measurement was obtained from, i.e. right or left arm or right or left wrist, and patient position, i.e. seated, standing, or lying down. Remember, if it wasn't documented, it appears as though it was never done. Also remember, the MPP quality team and payers are looking for blood pressure retakes in your patient medical records. Lastly, let's go over the billing aspect of blood pressure control. Information that patient claims should include would be to submit blood pressure CPT codes for each office visit. There are different codes for systolic and diastolic readings. The best way to close treatment opportunities for HEDIS is through a billing claim. Analysis and application. Now that we've reviewed proper blood pressure education, let's test your knowledge. Here's a scenario. You've roomed a 34-year-old female patient and have taken vital signs as part of the intake process. The patient's initial blood pressure is 140/85. Should you retake the patient's blood pressure before the appointment ends? Yes or no? The correct answer is yes. And the reason for that is the systolic reading of 140 is at or above NCQA's threshold of adequate control. Let's again test your knowledge with a quiz. Which blood pressure should you document in the patient's medical record? The first blood pressure, the second blood pressure, or both the first and second blood pressures? The correct answer is both the first and second blood pressures. The reason for this is we have to prove through our documentation that 2 readings were taken. Some insurance companies allow a systolic from one reading and a diastolic from another reading to be combined to create an adequately controlled blood pressure. Let's now touch on communication and patient experience and the importance of that. Communicating with your patient is a part of a patient's overall experience at the office, so let's make it a positive experience. Always explain what you will do and why you will do it. Again, always explain to the patient what you will be doing. If a second blood pressure measurement is necessary, you could inform the patient with this example. I will retake your blood pressure at the end of your appointment, Mrs. Smith. And again, we should always explain to the patient why you are retaking their blood pressure. Again, here's another example. Your blood pressure was elevated. Seeing a doctor can feel stressful and cause your reading to increase temporarily. I will retake your blood pressure at the end of your appointment, Mrs. Smith. Patients usually feel less stressed by then. Thank you for joining McLaren Physician Partners Blood Pressure Education Module. Let's now review and wrap up. Participants have completed the following learning objectives from each category. Knowledge. You have now reviewed the fundamentals of blood pressure measurement and the factors that influence blood pressure elevation. Analysis and application. You have now demonstrated when it is appropriate to recheck a patient's blood pressure using the defined threshold and accurately documenting both readings in the patient's medical record. Attitudes. You have now attested to the importance of communicating to the patient why rechecking a blood pressure is important. Thank you.